So it is April 11th. It is 7:31, and the meeting of the Fairfield Town Board of Health is called to order. I think we have a quorum.
Yep. 4 members.
Okay. So I guess to start, everybody got the minutes. You guys got the minutes to the last meeting. Were there any additions, corrections? If there are none, then...
Hi, this is Ava.
Oh, hi, Ava. Welcome.
Hi.
Any other board members on?
Just a member of the public, Henry Yoon here.
Hey, Henry.
Hi, Henry.
Henry.
Oh,
Hi, Henry.
Former chair.
I know the name.
He's just checking up on me. That's good. I like that. So can I have a motion to approve the minutes from last time?
So moved.
Second. All in favor?
Hi.
Any opposed? No opposed. So the motion passes, or the minutes are passed. So welcome. Hi, Sal. So we can start with the reports. We can start with the director's report.
So I'll just do a quick overview of COVID activity, sort of at the federal level, state level, and local level. The U.S. CDC shared today. We were on a call with them. Cases are about 9.6% up week over week. Hospitalizations are 6.2% down, and deaths are also 11% down. So we are seeing some increases of cases at the national level, but no impacts yet on hospitalizations and deaths. BA2 variant at the federal level is 72% of all the cases that are occurring right now, but still using the new community levels indicator that the CDC came up with, 96% of the counties in this country right now are at that low level, which they said essentially is equivalent to 96% of the population is at that low. The counties are at the low level of activity. In Connecticut, we are seeing some gradual increasing of cases. We're week over week, we're kind of seeing, last few weeks we've seen like a doubling of cases, although the numbers are still fairly low, lower than any of the other the peaks of any of the other waves still. And at Fairfield, the last 2 weeks, we've actually seen, in the state, we've actually had some of the highest case counts in the state. But in the past 2 weeks, we're also trending downward in terms of our cases week over week, our cases by specimen collection date, our cases by report date, all seem to be trending downward. And Fairfield County, as I said, is, as well as the rest of the state, is in that low community level category. When we look at what's going on, so we have these cases. Are we having any clusters or outbreaks or things like that? And we're not really seeing anything like in the nursing homes. We're not seeing anything associated with the schools. We're having smaller types of things, but it's really community-based cases that are going on and very widespread. So we're not seeing anything, for example, at a nursing home having, 50 cases, or a school sports team with lots of activity. And so, while we don't like to see the cases having had gone up, we're happy to see that it's trending downward now. And hopefully, it's again, we've been wrong about many predictions before, and so we hope that things will keep trending down, but we don't know if this is just a blip going down and could bounce back up. But for right now, it appears to be trending in the right direction. For our vaccination, we're up to 77% of the population fully vaccinated, with 47% having a booster, and 84% having initiated their vaccination. And in the 5 to 11 category, we're up to 52% fully vaccinated, and the 12 to 17 category, we're at up to 76% fully vaccinated. We continue to have clinics. We had a clinic on 317 for 12 and olders, just any shot that you wanted whatsoever. Within the last month, the CDC approved an additional booster shot to be delivered, and so we had a clinic on the 5th of April. It was a smaller office-based clinic, which did fill up pretty quickly. Did a little over 100 in a few hours of second boosters only. And then we're actually having another clinic tomorrow for Pfizer second boosters and one on Wednesday for Moderna additional boosters. But even those aren't, at least not right now, robustly, they're not filled up and they're, not big numbers so far. So we'll see how long that continues. We'll hold a few more office-based ones. And if they do somehow fill up and keep filling up, then we'll just go for a bigger clinic and do, several hundred in a day. But at least at this point, it doesn't seem like the demand is there. We did present our budget to both the Board of Finance, who approved it without any changes, and this past week, the 6th, to the RTM. So we'll wait and hear if they have any reductions. They can make reductions. But it seems like, that may not be the case for us. We have had 2 staff resign recently. Our data entry clerk accepted a full-time job as a paralegal, and so she left us last week. And last Friday was the last day for one of our sanitarians who's been with us for 12 years, Amy Lahaney, who's been, a big part of our department in helping us with a lot of things. She's accepted the position of the Assistant Director of Health for the City of Bridgeport Health Department, or Deputy Director of Health, excuse me. And so she started today and has a big office from what we hear. So we'll start the process of trying to fill those positions. And then we did have the Connecticut Department of Public Health Food Protection Program did approve recently, which they've never done in the past, is online training programs for the food inspectors to be recertified. So all of our food inspectors have to do 16 hours of continuing ed credits, and it's always been, in-person trainings, or, you have to attend the state ones that they organize and then a few others. And so recently they approved some online FDA training programs, and so our staff has been busy working at that. So they kind of, it's typically every 3 years, and then during the pandemic, they kind of put everything on pause, and within the last few weeks, they sent out some letters saying, all right, by the end of this year, 22, we want everybody to have 16 hours, and so all the staff, and there's a series of 2-hour or 3-hour courses, and so the staff has jumped in and started embracing those and taking those. And then we are happy to say one of our staff, Kim Wynn, who's newer staff here. She works on our preparedness grant and for our Medical Reserve Corps. She submitted an application for what's called the RISE award for the Medical Reserve Corps, and she was awarded a $50,000 grant, and so that's will fund the MRC through over the next year with, it has specific contract deliverables of conducting training and recruitment. And so we're happy for Kim and for the department getting that additional funding right at the time when the state has eliminated direct funding to local medical reserve corps. So they had been providing direct funding through our preparedness grant. It was ASPR funds coming through the state, but they were basically giving us about $7,000 a year for the last few years for the Medical Reserve Corps, but then they eliminated that, and it goes through a different process where you can no longer hire staff. And that money was really to pay part of somebody's time to do all the activations and trainings for the Medical Reserve Corps, but this will provide funding for us for a time to achieve that and to make a few big steps forward with our Medical Reserve Corps. Now that the activity has calmed down, it's a good time for recruitment, as people are interested in being people who we couldn't bring in necessarily during COVID because they weren't part of it already. now we can recruit them, train them, and bring them in and increase our numbers a bit. But we already have about, I think we're at 295 members in our medical reserve corps. But we'll look to increase that. We do have scheduled for Region 1, and the department will be participating, as well as the town will have participation from police and fire as well, in an anthrax tabletop exercise to be hosted at Sacred Heart University coming up on the 29th of April. And lastly, we did have our Girl Scouts and Government Day this past week, and so we hosted two young women who got to go out in the field and see how to inspect a restaurant and see how a septic system works and gets installed, and went over to nursing and got to see the clinic space over there and talk with Santina, and so it was a good day. Unfortunately, I wish I could have spent more time. I had a meeting with them in the morning and talked to them about the health department, and they do a presentation at the end of the day of in front of the other scouts and to talk about what they did. And so that's the goal, is always to get them, prep them with a good, concise thing that makes your department look good in front of the first select woman and others. Yeah. And so we train them up on disease prevention and and enforcement and all that, that hopefully they get a good message across. But that is my report today, and that's what I have.
Thank you very much, Sam. It's a lot of good news. That's $50,000 grant.
$50,000 grant, and it's our first grant application, so I said, Kim, I think you should do this and write it up, and I did a few edits to just some of the phrasing of it, but it was really all her, and so and I said to her as well, if you get it, you get to do all the work related to it as well. Hire the people and oversee them, and so. But it's a great experience for her. She's has a degree in public health and is working on her master's in public health right now, and so it'll be a good resume builder for her and good experience, I believe.
Cynthia, thank you very much for joining us.
Well, thank you for having me today. So Sam's asked me to come over just to kind of talk about what we're doing in community health. So one of the things I do is I oversee all the contact tracers. We are shifting from contact tracing to more health education, so we are still calling as many positive cases as we can and just kind of going over the quarantine and isolation guidance and making sure that they're contacting their contacts. And then we can help them if they need, answer any questions they have. We're also helping the school nurses with surveillance of COVID in the school. So we have had a few little clusters here and there, and so we're helping with that. And we do have our contact tracers working on like a COVID project. So one of the things we wanted to do was capture everything we've done over the last 2 years and put it on the website. So we're working on a timeline and trying to gather some pictures. Even though it's all blurred to us, it's kind of cool to like look back and say, oh, that's right, that's what we did and that's what we went through. As far as our programs, a lot of our health education programs are coming back. So we do have a diabetes and chronic disease support group that we have at the Senior Center that meets the second Tuesday of every month. So that is back in full swing. We have it actually tomorrow, and we're doing a Know Your Number screening. So one of the things we did pre-pandemic was go out into the community with a public health nurse and do Know Your Number. So we're doing blood pressure, BMI, cholesterol, and A1C. And this is going to be the first time we're doing it post-pandemic with the support groups. And so we're hoping to bring that back. We also have a Healthy Lifestyles program, which is a 13-week a weight loss program, but it's more about like how to make healthy lifestyle changes. So we talk about healthy eating and physical activity, and we're hoping to relaunch that late summer, early fall. And then as far as social media is concerned, I don't know if anyone follows us on social media, but over the last last week was National Public Health Week. So to celebrate, we worked with our partners in Region 1 to create a series of videos of what public health departments do. So pre-pandemic, you ask someone, what does the health department do? Restaurant inspections. during COVID, what does the health department do? Talk about COVID. So we wanted to show that we do more than just restaurant inspections and COVID vaccinations. So our video specifically was on safe housing for renters, but it went everything from blood pressure to health equity to well water testing and everything in between. And so from that, we're hoping as a region to start doing videos once a month to highlight different aspects. Next month, we will be highlighting public health nurses. And then we are working towards our community health needs assessment with the local hospitals and other local health departments. They've been collecting data. Right now, they are going to be going to the library tomorrow to survey Fairfield residents, and this is kind of the last part. So we used to do some focus groups in the previous years. This year they decided to do surveys, so it's a 10-minute survey. Fairfield residents can go, complete them, and they get a $15 Stop and Shop gift card. It is limited to 25 people, but that's something we're doing. And then finally, we have a Preventative Health Block Grant that we receive every year. And what we've been doing with it is the bike routes and the bike repair stations, pedestrian safety. So we just did a sidewalk at Wilson Street. We also connected the Lincoln Park area with some sidewalk and some new fencing. And this year, we're going to be doing some more sidewalks. And with the Bike Pedestrian Committee, we're going to the Police Commission for an additional bike route. And so I approached the state with that idea of the additional bike route. They liked it, and so they gave us an additional $7,000. So that grant will be $23,672 to do towards bike and pedestrian safety. And I think that's it.
That is great.
You have, are they doing the Earth Day?
Healthy Kids Day?
Healthy Kids Day.
Oh, yes, that's right.
Yeah, is it Earth Day and Healthy Kids combined?
Yeah, on April 30th, we will have 2 staff members going to the YMCA for Healthy Kids Day and Earth Day. So they'll be talking about the health department. We also have some bike reflectors and pedestrian tags that they'll be handing out. So yeah.
That's great. Now the support group that you said about, is it just for diabetes? You said it was combined with?
Yeah, chronic disease and diabetes.
And who runs it?
So I do with, her name is Courtney. She's a registered dietitian with Rehab Associates.
Fantastic. And
yeah.
How do people find, how do town residents, how do they find you on the website?
It's at the Senior Center. So we do advertise it on our website, and it is on the My Activity through the Senior Center. And we do a mailing. So we send out probably about 35 letters. We were getting a big following pre-pandemic. We were probably getting about 12 people coming consistently. Right now we're about 5 or 6. But those people are coming consistently, which is really nice.
Yeah, You've reached out to local medical practices in the past about referrals from local doctors.
Yeah.
And then since Courtney's at Rehab Associates, she also advertises it through there too.
Great. Thank you very much.
Thanks.
Sounds great.
I have a couple kind of questions. Thank you, both of you. Okay, one question I do have is why invest so much energy still into the contact tracing piece when that's not really happening in the schools? And then also, with looking at these numbers, trajectories of, okay, there might be a slight uptick in cases, but that's not reflective in the hospitalizations, in the deaths. I'm just wondering kind of why we're doing that, because it almost seems like at this point it's a waste of resources and inconvenience, because, even with Dr. Fauci speaking this week and it moving towards this, what many of us have felt for a long time, but moving towards just personal assessment of risk, and that we aren't doing that with pneumonia and the flu and colds, like all this type of contact tracing, because it's just beyond containment. It's like we are going to be living with this. It is what it is, and what is that actually achieving? So that's like one question, and then I have another question after that.
Okay, so our contact contact tracers are grant funded, and they're funded until May 17th at this point. And we're not doing contact tracing as much as we're just reaching out, finding out, going over the guidance, seeing if they need anything. What we do find is, some people don't answer our phone call, and that's fine, and we move on to the next person, whereas, in the height of the pandemic, we were calling them 3 times and then sending a letter. At this point, we're making 1 or 2 attempts. It depends on the caseload. And we're finding that people are actually pretty receptive. So the big question we get is, well, I'm supposed to travel. What am I going to do? I have a positive test, and I'm traveling overseas, and I need a negative test. And so that's where we can provide that education and say, well, actually, once you've recovered, we can provide you a letter as documentation so you don't need to get a test. And it kind of keeps those lines of communication open.
I would add to it that we're essentially transitioning them away from that. We're utilizing for other things as well. But we have 4 part-time individuals on a grant for the next month or so.
Okay.
And so we're...
it would make more sense to me anyway to, if you said you're transitioning into utilizing, I can understand if it's like free money, okay, this is being funded, but not to just go through motions of something just for the sake of going through motions of something,
for example, the clinics that we have, we're receiving a number of calls today, and so we're having the contact tracers doing that call back and helping seniors get into the VAM system because a lot of them have forgotten their passwords and things like that. So they provide a variety of different services for us, and the primary function is really assisting the school nurses to take some of that work off of them in terms of calling back families.
Okay, thank you.
Sure.
And then the next thing I wrote down was you were just talking about the bikes, the bike routes, things related to that. Is there a way that there can be another push towards, the bike helmet piece maybe and that bike safety? Because what comes to me is that meme. I don't think it was a meme, but it was a picture that was going around, you'd have kids or adults like on a bicycle or motorcycle with a mask and not a helmet, you know what I mean? And it's just like taking a look at that from the big picture of things. It just doesn't make sense if you're really talking about safety. Obviously, I've worked with traumatic brain injury patients, some from bike accidents, and that's I know that I've heard that the police officers will sometimes hand out like a free ice cream certificate or something when they see, a kid who's wearing a helmet. It seems like there could be a little more promotion or positive reinforcement, as it's getting into spring and summer. So just an idea, because that's definitely like safety and...
Yeah, and that's been something that the Bike and Pedestrian Committee has talked about. They're actually hosting a bike rodeo on, I believe it's May 1st. I'll have to go back and double check. But they actually will be handing out helmets and doing helmet checks and things like that. But yeah, that is something that that committee is cautious about.
Yeah, I think it's like a lot of times people have the helmets. Like I know my kids even have the helmets, and then I'll catch them without a helmet, and I'll be like, you need to wear your helmet, So it's like kind of the positive reinforcement, or also just unfortunately, the like what can happen if you don't wear one. You know what I mean? And the implications of that, I think. So.
Yeah, I totally agree, Sally. I think that we all see patients.
Yeah.
It's the same with seatbelts, but it's those kind of things are very important, and no matter anything that we can do to promote that.
Right.
When we were down in Delaware last summer, and the town, it's kind of a very similar thing. We were all on a bike ride, and in a very sort of public area. The police, and there was a whole group of people. Everybody was stopped, and it was the local bike shop giving out free helmets, giving a lot of information. It was just fantastic. So that kind of thing works wonders. And obviously, we want all parents to make sure that obviously we want.
And again, it's like it is like a free will thing, like which I am clearly a proponent of. But I could see if there was just a little more like education or that positive reinforcement of it, it would be helpful. And like, just as we get into spring and summer, I'm thinking about all the complaints that come up in the beach area and cars going too fast, or, you know what I mean, things feeling much more congested, and I bet this summer is going to be even livelier, with people out and about, so. Okay, cool, thank you so much.
I actually have a couple of questions about the MRC.
Sure.
I guess it's sort of a two-part question. First, with the pandemic, the MRCs, I think, became much more utilized than probably ever, it seems, with, running vaccination clinics, et cetera, being used for contact tracing in some towns and other resources. So why did the state cut out grant funding for the MRCs, considering that? And two, now with this grant of $50,000 that we have, how is that going to help our MRC grow, and what is their role now kind of during this not as needed time?
Yep. So the first question is one that we're all kind of scratching our heads of why did the state cut it. The reasoning the state says is that the funding stream comes through ASPR and the HHS side of the funding versus the Assistant Secretary for Preparedness and Response, which is the preparedness dollars. So they've kind of at the state level combined these two funds and have given the MRCs, funding for the last several years, which has been a good thing. But the regional administrator has said it's not really the way this funding is supposed to be used. They didn't put their foot down for a number of years, and then during the pandemic, they just said, we're going to leave it as is, but the state feels that they are not complying with the intent of the source of the money, and so the money is being not quite the exact amount, but $150,000 of the, I think it was or maybe $300,000 total that went to all the MRCs in the state. Is $150,000 is going to what's called the Healthcare Coalition, where MRCs can still submit for funding for projects, but those projects can't include like what we use the funding for now, which is a staff member, adding on 5 hours to Kim's time so that she can focus 5 hours a week on the MRC. We can't do that anymore. And so if we wanted to hold a training, we can submit to the HCC for $2,000 to rent a room at Sacred Heart or whatever it may be. But they're getting, as years go on, they get tighter and tighter with what the funds can be used for. Like we can't pay for any food, but you can pay for safety vests, but you can't pay for, promotional items, like, handouts and things like that. So they feel like they are trying to get closer to the intent of the money from the federal government. That is really why they're saying they're doing it. So, and the $50,000, so it's essentially there's three things that we're going to achieve with that. We're going to do a recruitment campaign. We're going to train those new volunteers, and then we're going to offer a training for existing volunteers, and we're going to have so the state acquired a new volunteer management system called CT Responds, and so we are going to transition to that database, and so that takes some logistical stuff to do in terms of uploading lists and entering people and correcting data and troubleshooting, and so that's one of the things, and the funding's actually from June till the end of December, so it's kind of a weird period, but so during that time, that's what we hope to achieve is to have a recruitment drive, to sort of revamp our basic training for the MRC members, and then give a training to the existing members, and then transition to that new database. Those are the deliverables that we submitted.
Great, good stuff.
So now the MRC is how many? You said 200 and...
About 295 members.
That's great.
Yeah. So it's and it's we say with our MRC. So the other part of your question was what's in the future for the MRC. So what we try to do with our MRCs, there's other MRCs that are more active. There's a search and rescue MRC. There's a MRC attached to the Governor's Governor's Horse Guard. There's an MRC that does MRCs that do different things. So we've been fairly consistent that we train for mass dispensing, and we ask people. The big thing we ask of MRC members is keep your contact information up to date and participate in a drill and an exercise from time to time, and attend to training from time to time. And so we try to have one, pre-pandemic, one large annual education session, where it's usually 1 to 2 evenings at the senior center, where we bring them in. We have a bunch of different training sessions, and even sometimes at those times we have exercises. And then we would also typically hold, I want to say not every year, From 2005 to about 2011, we did it every year, and then it's been kind of every other year since, is some kind of drill or exercise where we, for example, 1 year back a while back, we had, solely an MRC run flu clinic. So we're going to have the flu clinic anyway, but we had all MRCs come in, volunteers playing every role other than one or two staff members there to do training, just-in-time training, and to make sure everything's going smoothly. And so those are the types of things that we ask of our MRC volunteers. Other departments use them for community. It's the Stratford Day, and there's a booth, and they man the booth and do things. And so but every MRC is slightly different. We've never gotten into that. We have a robust fire department, a robust police department. We've got a robust CERT team. We've got a good, high-quality ambulance service in town that at almost every race or function or event, they're doing first aid or have a first aid tent. So there's not a demand for that for the MRC, whereas you go up more in Litchfield County and things like that, they do first responder, what do they call it, for the firemen. When they're engaged in a fire, they come out and they have a tent for them, firefighter rehab, I think they call it, where they come out, they take a seat, they get their blood pressure checked to make sure they're okay before they go back in, if it's a large event. So they're trained to do that. But our role has really been mass dispensing. Keep your contact information up to date so we can reach you. And we've also play a role in sheltering. We come alongside the CERT team and provide that sort of medical component to the shelters to supplement that.
Great, thanks. Thank you.
Quick question. You had, and I apologize because it's so late in the game, I should probably know the answer to this question, but you mentioned nothing alarming, but possibly a cluster or two. What's the technical definition of a cluster? 2, 5, 10? What's the
Well, it's when we use that term, and Santina, correct me if I'm off with your interpretation of that term, but when we suspect there's some kind of in-school transmission going on, we'll call it a cluster. Where if it's in a household, yeah, that's a cluster, but we can understand the context of why that's spreading because they live together. Whereas if it's we had at one of our private schools, there was 8 to 12 cases or something like that were loosely connected, and we're saying, okay, something's going on there. That was a little while back, but but it was we could see what was happening and define it and say we're pretty confident in our suspicion that there was some degree of in-school or defined transmission going on. So in that particular event, it was socializing. Yep. It was a component of that. So that's what we kind of generally use it when we think, okay, it's something different going on, not just household transmission, but it's related to an event or a school or a gathering or something like that.
Right. I hear cluster and I hear 50 people, or something.
No.
So, okay.
Yeah.
Okay, thank you.
Sure.
Were there any communications from public that anybody wanted to talk about?
I did not get any.
Was there any old business from last meeting that anybody wanted further discussion on? Any new business?
Well, we do have, I provided a copy of a draft of our annual report, and this is a very early draft, so we're giving it to you to feel free to review, and if you have comments for now, we'll gladly take them. But just and not necessarily we're not looking for grammatical edits and things like that. We'll take care of all that because I did pick up on several of those. But in terms of, if you think there's something there that there should be something there that isn't there, some other perspective on some of what's there that you'd like to see. So what we're doing with this is we're trying to achieve, we didn't do an annual report since 2019. The state basically waived that requirement for us to do an annual report. So we decided to go back, and they said we're just going to let those years go, and we'll start now. But we've decided to go back and do essentially a 2-year annual report that sums up 2020 and 21. Just it's something we want, and it's going to feed into the project that Santina referenced, where we're doing this COVID historical project of trying to capture interviews and content that was developed and to, centralize that into a web page and some documents.
So I have a question about some of the data, actually.
Sure.
I'm looking at the very end of it when it talks about community health staffs. Actually, just a typo. It says health, not health. But I'm wondering, I know obviously about these things all being reportable to the state. I'm wondering how it's transmitted to the town. I'm looking at these numbers. They seem extraordinarily low for a town with this population plus 2 universities, especially when I start looking at some of the more common things like gonorrhea, chlamydia, even Lyme disease. They seem extraordinarily low. So, for example, the college students, are they going back to their hometowns wherever they're legally registered from? Are there things potentially? Is there a whole not reported set of information from some of the providers out there? And this just seems really low to me. And it's consistent across the years, but still, for a town of 50,000 people,
So this data is pulled directly from the Connecticut's Communicable Disease Surveillance Network. So it's all the medical offices, as you guys well know, are required to report these, and so there's always compliance issues with that, with some people not reporting when they should. So that's a given in the data, but so it all comes from that, and it's improving as we go along because now with COVID, they've got better connections to the laboratory data. So labs are also submitting directly to CTEDs, the database that I referenced, and so the data is getting better. But yeah, it's and that part of the college student experience of them living at home and going using their own doctors and things like that. That's just a reality we have to deal with. As we have with COVID and with the vaccination rates of the 18 to 24 year olds or 19 to 24, 18 to 24 category. That's just in our data. Like those numbers drop way down, and if you look at other college towns, you see the same pattern that that age group is much lower, and it's probably because they're just
It is starting to go up this month. We've had a handful of cases, not like drastically, but it is slowly going up.
So I didn't realize, so a lab like the Quest lab, they get a positive result. They can report it directly to the state.
It's right now like all their COVID tests go electronically directly to the state, and so that's happening with more and more regularity of that's how the data is getting to. They're somewhat bypassing the doctors and just going right to the labs and saying, it's automatically reported in, every night. So we'll pull that data from there. So our staff looks at that. We have staff that have office hours. They log into the system. They look at what cases we have, and then they get assigned. So if we have a tuberculosis case, it goes over to the nurses. If we have a salmonella case, we have it assigned to one of the environmental inspectors who'll do the interview with them, and like that. So that's how we'll address those. But we pull from one common data source.
I think I just want to kind of make a statement just in light of the last 2 months and the changes, and obviously, you certainly know that Christy and myself and other people who are major proponents for the math choice, I just kind of want to throw out I think there have been a lot of positive results to that, and I think now that it's a little bit of time has gone by, we're not seeing some huge spikes happening in the schools. Like we're seeing really consistent data overall as far as transmission not occurring, I think, in the way that originally it was thought. And I think, there's something to be said for all of the other positives as far as the kids in the schools and being able to see each other and see their facial expressions. And just, my kids at Tomlinson had a musical this last weekend, and so did, Ludlow and Woods, and the fact that they were able to do those musicals without masks, and that people who are attending could come and have a choice of whether or not they wanted to use them, and certainly live music venues. And, Dr. Mrose and I actually were at a huge banquet in Connecticut in Southington, because actually her daughter and my son got the senior awards for performing arts, and that was about 1,800 people, so I'm just saying, like, we're talking about, this has been a really big change. This was a lot of, everybody was worried about it, and I know obviously the climate has changed, but I think, I don't know, I just wanted to make sure that we're acknowledging that there was a lot of, oh my gosh, what if we did this, all the bad things that would happen, and I mean, I'm seeing the opposite of that, and again, the mental health piece that we've been trying to touch on, like really reminding ourselves to look at the big picture of what health is, you know what I mean? And that health isn't just COVID, it isn't just containment, it is also a holistic thing, right? It's the mind-body connection of each individual, and just, anyway, I just want to kind of throw that out there, because I think we really need to keep focused on that as well, and as things maybe do change and there are these like little upticks. I mean, I've looked at some of the charts that were going around just over hospitalizations that came out more recently as they put together 2018 versus 2019 versus 2020, and there really wasn't I mean, 2020 was even fewer hospitalizations in Connecticut than in 2018 and 2019, So, and, emergency room discharges. So I just think it's interesting to, like, continue to also, I mean, I think it's good that you're doing this and going backwards, too, but really synthesizing, okay, decisions that were made and how that's going to change the trajectory of decision-making in the future. So it's not necessarily, like, knee-jerk reactions or things that we think that we should do just for the sake of doing it, So that's just kind of a statement, but just want to get it on the record.
Yeah, I think it was the right time. I think that, years and epidemiologists and historians will look at this last few years and look back and analyze the data. I think that in large part, I mean, listen, there's so many things could have been done differently. But I think that in large part, I think a lot of the public health aspect of this, I think the public health departments around the country, I think, did a really pretty good job.
Well, they totally. Yeah. I mean, it was obviously just so vastly different from state to state or country to country,
right. And so when we're faced with these kind of problems, and this kind of, we all keep hearing the word unprecedented, but in any case, so this time in our lives, all I would say is that I think that it was a strain on the medical community, it was a strain on children, on educators, on everything. And I think in the big picture, I think we'll look back and say that I think we did pretty well. A lot of people are listening. There was a tremendous number of deaths. We know that. And but the big picture is I think that the timing was right, and I totally agree that now is the time that I think for people to continue to live their lives and move on and move ahead. And if people still want to wear masks, I think they shouldn't be ostracized for that. If they feel like they're still, worried about it, that's why I think that's why I think that the people reaching out to people, because some people still have questions. People still have concerns and questions, and are not totally. They don't totally understand what the risks are now and what they're not. So I think that's important, and that's a huge role for the public health department to have people that have that resource. But I agree. Listen, I think it's fantastic that people can gather today. There could be concerts, there could be musicals, there could be everybody's back, sporting events, all those things. But I wouldn't. Basically, my concern would be that. We don't want to look back and say like, but this was sort of not handled appropriately, because I think that it was in large part. But
if I could piggyback off that, but go in a different direction from a town standpoint, I think this whole pandemic has brought a lot of awareness to mental health and specifically the children's mental health. Does the town have any initiatives kind of in the works in terms of increasing access to care, increasing recognition, et cetera?
So, we don't provide direct services, and I think I shared it maybe at the last meeting, that, we look at it, our role in that regard in terms of making connections to resources. So we have a very robust webpage with all the behavioral health resources there, from every available crisis text line, call line, and then all the other, sort of those are the national ones. We just had a presentation on the 988 creation for behavioral health crisis line for a national, instead of 911, you call 988 when you're having a behavioral health crisis. And that's rolling out. But basically we look at our role as, connecting people to those resources. So if they happen to look to the behavioral health department to say, what are the behavioral health resources in the area? Well, our website's going to direct them to, whatever needs they are. And Santina could, you wrote it, so.
I also sit on Fairfield Cares, and they talk a lot about mental health and substance abuse and things like that. So I try to share their information whenever possible in our social media accounts, and we kind of brainstorm together. So we do take an active role in there.
And then from the preparedness side, we work with the mobile crisis teams, sort of, part of our Region 1 team is folks from the state that work for behavioral health agencies at the state and coordinate the mobile crisis teams that respond to events, with licensed professionals.
Can I just to add, do you ever do anything with the pilot house in town? And that's another guess not, the blank stares are telling me no. Okay, so far, never mind.
What is that?
I'm just learning about it now, and I don't want to speak for them, but I would actually love to maybe have a side conversation about the pilot house and programs that they run for some. My daughter actually goes there, so it's just another outlet, I'd say, for kids that I think we fund it through some it's a line item in the budget, in the town budget, and I just think that it might be a under advertised yet. And if it only was just 2 or 3 extra kids, but it's still 2 or 3 kids.
Well, if it's a behavioral health resource, that's available in the town, we'll put it on our website.
I think maybe we can have a side conversation.
Absolutely.
About that. Okay, great. Thanks.
Any other comments before we? Thank you. So, if there's nothing else, can I have a motion?
I'll just say, if you have any comments on the annual report, feel free to email them to me, and we'll tally them up and get them to Mary Cannon, who's the primary author of it, and anytime. This isn't, this is anytime, say the next month or so, if you get a chance to look at it and send any comments, we're happy to have them. Don't worry about grammar and spelling. We'll get all those. Thanks.
Great. Thank you. Thank you. So,
motion
to adjourn. Second. Okay. Meeting is re-adjourned. Thank you very much, everybody, for coming.
19.
Thank you all.
Thank you.
Where are you going?